The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today I'm delighted to have Patty Barnes here with us. Welcome, Patty.
Thank you, Don.
I understand that you are a certified professional midwife. And how many babies have you delivered now?
Well, over 750 babies by now.
And you know all the families and everything about them now, right?
Well, we're forever learning.
Well, good. We're glad that you're here with us. Today we're going to talk about something that you're very familiar with, and that's home births. Are they a good idea? Are there reasons that maybe they're not a good idea? And we're going to talk all about that today. First of all, I guess that's a good question to start with. Are home births a good idea?
Well, some of the couples are getting back to home births.
Mm-hmm.
And I think probably because they want to have a natural birth in a private home setting, mm-hmm. and be able to labor at home where they're more relaxed.
About all the people, of all the people in the world that have babies, would you say most of them are at home?
No, I'd say most of them are in the hospital, of course.
You mean in America or in the world?
Probably in America.
In America, they're mostly in a hospital. But around the world, if you're not talking about a Western country, most people don't go to the hospital, do they?
I guess not.
Okay. Well, so you mentioned some reasons they're making a comeback. Why is that?
Probably because a lot of the Christians that I know, they just want to have it in the privacy of their own home, so that the fathers can get more involved, and they can labor in a natural setting, and they seem to be comforted in their own home, or mm-hmm. relaxed. And
are there things in a hospital that make hospital a good setting for any reason? Like
mm-hmm.
like what?
Well, they have medical emergency equipment and pain relief drugs, and if a problem arises, they can do surgeries. And also, they have people wait on you, so that makes it very appealing.
Mm-hmm. So I assume that you work fairly closely with physicians in a hospital if there's a need that arises.
Yes, if we have a high-risk situation where we need to go in the hospital, and the lady would like to have me there, the doctors always let me go into the hospital and work with them also in the hospital setting. Mm-hmm. But we believe that high-risk situations need to most definitely be in the hospital.
Mm-hmm. So what do you take with you when you go on a home birth? Do you have a big kit that you take with you? Do you have, how many people go with you?
Well, I have an assistant who is also, she's trained in neonatal emergencies, mm-hmm. and we have emergency equipment, two oxygen tanks, and just, which we hardly ever use, but like I said, high-risk individuals are supposed to be in the hospital, so therefore, if you just take low-risk patients, then there's going to be very, very rare should you ever have a problem.
Mm-hmm. I understand you just have finished a new book on all these experiences you've been having, and it's called The Ministry of Midwifery. Mm-hmm. And you look at it really as a ministry, don't you?
Yes, this is a ministry. God has led me into this ministry, and I don't treat it like a business. We're out there to help people. The doctors, my backup doctors they're encouraged that I'm trying to break down the prejudice between some of the patients that otherwise would not get prenatal care, mm-hmm. or go into the hospital when they need to.
So there's a lot of people that you work with who wouldn't go into the hospital usually under any circumstance or see a physician.
Right.
And so you kind of are the liaison, or you're the person that introduces them to one another and
Yes.
help them meet their goals.
Yes, try to help them to be able to have more confidence and going in and knowing that if they have to have a hospital birth, they can still have a good experience.
Are there any people that are going to have babies while you're gone that you're worried about right now?
No, I'm on a little break.
You're on a little
Right
break,
now.
so someone else is watching over them for you.
Yes.
Well, I'm glad that you could come and be with us. You know, understandably, I think perhaps there would be those in the medical field that what might have a little disquietude about home births, might have a little disquietude about these things. What kind of things can you share with us that would put us at ease about that, or at least give us something to think about?
Well, there has been some studies done on the safety of home births. One of them is the Mill study, and that was done by Dr. Lewis Mill, who compared 1,046 home births with the same number of hospital births. And the couples in the group were matched closely as possible in their characteristics. There were 3 times as many C-sections that took place among the hospital group, and far greater use of anesthesia in the hospital. And there were more episiotomies, which is cutting the perineum, to create a bigger opening for the baby to come out, and more tears of all degrees in the hospital. There were 3 times more postpartum hemorrhage in the hospital and 30 neonatal injuries in the hospital. None in home births. More babies needed resuscitation in the hospital, and APGAR scores were considerably higher. But Don, also the study could be a little slanted, because we don't, if midwives really do their job, they're competent, they would only take low risk, so you're not going to really have a lot of those problems.
Okay, so in other words, this study looks like everybody should have their baby at home, but that's not really what it's saying. It's saying that the nurse wife, the midwives or the nurse midwives or whoever's doing it are very competent about knowing what a high-risk situation is.
Yes, they should be.
They should be.
Yes, they should be.
What are some of those high-risk things? I know we may talk about that a little bit more, but what are some of those things that they notice?
Well, for example, breech or twin deliveries.
Okay, so when there's 2 babies, or when it's not positioned in the right place in the womb, or
people that have hypertension, PIH, which would be pregnancy-induced hypertension.
Okay.
Gestational diabetes, which would produce large infants, would be a problem to get out. They would need to have a C-section.
All those different kind of
all
things.
those different kind of things.
So this does show that home births are safe, but part of that reason is because the midwives are competent in knowing what's not really safe and referring that if they need to.
Yes, they should be. But then again, we let birth take its natural course. I think that a lot of times some of the interventions in the hospital can cause problems also for the baby to go in distress.
So in other words, some of the pain medications, some of the other different things, maybe your opinion is that it's not as needed if you wait long enough for different things.
Yes, and a lot of the doctors will tell you that. I know that one of my doctor backups, he's very much in favor of home births. He thinks that low-risk individuals should be able to have their babies at home.
Any other information that you have for us that can answer that question people have about home births?
Yes, there's another study done. It's comes from the Journal of the American Medical Association, and they published an article in 1980, research done on 1,296 home births. Now, there were 933 that were planned home births, and 246 were unplanned. 117 were unknown.
Okay, so that was the sample. And then what happened?
There were 36 neonatal deaths total, but 30 of the deaths came from unplanned home births. 6 deaths were planned home births, but the 3 were unattended home
3 of that 6?
Yes.
Okay.
Unattended home births. They were unattended by midwives, okay? The 3 deaths attended by midwives were all due to congenital abnormalities. So wasn't conducive for life anyway.
So what was the upside of their study then? What did they mean to say by all this?
Well, the author stated that low-risk deliveries at home with a trained attendant are associated with low neonatal mortality. There should be no reason for elimination of home delivery as an alternative supported by the medical community.
So in other words, those numbers were pretty good.
Yes.
They found that really you're doing a good job, or people like you, and you should just say that you're not.
Thanks be to God.
All right. Well, that's good, and well, that's quite a shot in the arm for the midwife community, and that means that you're doing your job well. And true, thanks be to the Lord for the whole process, right? So people should feel comfortable about this, but you're not saying that everybody should be home delivered, right?
No, definitely not.
But for those who want that or think that, they should know that even the medical community looks at it and says, hey, you shouldn't just eliminate that option.
Yes, I'd say more of the medical communities seeing that more and more. But we definitely, even if they're low-risk individuals and they're not comfortable, they shouldn't be, persuaded to have a home birth. They need to be where they're most comfortable.
Be where they're most comfortable.
Yes.
So you're not out there knocking on doors saying, hello, I'm here. And,
No, definitely not.
No.
No.
Okay. But you're saying that for those that you do serve, that it is something
Yes, that's why this is a ministry. I let the Lord lead. I certainly don't, I'm not out there trying to find pregnant women. And some of the times the doctors will even, encourage me to go to different communities and educate some of the, I've been doing a lot of seminars lately in what they call the Plain community. It's Amish Mennonite communities where they have no prenatal care. They're not educated in a lot of the diet reform, and a lot of their high-risk conditions could be turned around if their lifestyle was different.
So you're really ministering to a community that no one really has reached out to before. So what you're doing, there wouldn't be anything done if you weren't there, perhaps.
Well, I'd like to think others were reaching out to them, but
you're very modest, I know, but I mean, it sounds to me as I've talked to you and have seen the ministry you're involved in is something that others really are not filling that need, so we certainly appreciate that. We're talking with Patty Barnes, a certified professional midwife. She's delivered over 750 babies, and she loves doing that. She likes working in homes with people who make that decision to help them have a healthy delivery there at home. She's written a new book about her experience. It's a delight to read. And when we come back, we're going to talk about things that really shouldn't be done at home and look a little bit more closely at what shouldn't be and what can be done if you're looking at home delivery. And we hope that you join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Patty Barnes. She's a certified midwife, and you do have some concerns about some of the things that go on in hospitals, although you work very closely with physicians in hospitals. Tell us a little bit about some of those concerns you have, some of the interventions and things that happen in a hospital setting that maybe even those that are involved with a doctor, you know, some places are going to be in the hospital. They're not going to know people like you or have midwives that could be involved. So, you know, we're going to talk about some things here that are done that maybe could help those that are even going to be in the hospital. What are some of your concerns?
Well, if when they go into the hospital, usually they're hooked up to external monitors. And
External monitor, what do you mean by that exactly?
well, it's external fetal
Oh,
monitoring.
you have a picture here, okay.
Yeah, and they will be timing the contractions and
So they put those straps around the abdomen, and is that
Right.
what we're seeing there on the picture?
the
There's
the top one's for the contractions to tell when she's having a contraction,
okay.
and the lower one is to listen to the heart tones of the baby.
So would you say that's a good idea?
Well, at home we listen to the heart tones through the fetoscope or whatever instrument you have, and we could find out if the baby's having distress or not. The only thing with the external monitor, and the next one is the internal monitor, which is
Okay, same kind of thing.
yes. You need to do what they call an amniotomy in order to. It's like a little fish hook that you screw into the baby's hood, this internal monitor. And in order to get it into the baby's head, you've got to break the waters. That's what they call the amniotomy.
Okay. So
and,
that's something they just put right there, and they insert it through the opening, and it's right next to the baby's head.
They screw it into the top of the baby's head.
Okay.
And that's to give more accurate heart rate, but it does confine you to the bed if you don't need to be in the bed, and you want to have a hospital birth. You want to be in an upright position. When we go in the hospital, they allow us to walk around and just be able to
So your
walk
major
through
concern
labor.
with it is not the good information it gives. It's not the fact that it gives the heart rate, it gives the contractions and different things. You want the person to be able to walk around and get up.
Yes, not have to be confined to the bed necessarily.
And why is that? Why do you want them to walk
Because
around?
by walking, it's not as painful as it would be laying flat on their back, but it also encourages the cervix to dilate because the gravity is in your favor with the baby coming down. Then in upright position, we walk the halls and we squat and we'll breathe together and we do some comfort measures like massage, and then we'll go back like they'll say we'll come back every hour and we'll do a monitor strip for maybe 15 minutes and monitor the baby's heart, and then they're fine with that, and then we could go and walk again.
I see.
So that they're not confined. And also,
Well, of course, you couldn't do that with an internal monitor.
no,
though.
you cannot do that with an internal monitor.
It would have to be that external one. So would it be appropriate for a lady and a husband that have a physician they're working with at a hospital or something to say, hey, look, we really would like to have an external monitoring maybe once an hour or different things when we're in there?
Yes, and now I know our doctor backups agree to do that. If they're not in a high-risk situation where they don't constantly need to be concerned. But we'll just go in and monitor it every once in a while and go back out and walk. And then also they hook them up to IVs a lot, which in the hospital where we're at, they don't hook everybody up to IVs when it's not necessary. So they can, if they want a natural birth, they can not be restricted.
And again, the concern with that is not that they're going to get a little extra fluid or this or that. You just want them to be able to move around.
Yes, and be able to, not have the excess interventions, because it does and can, stress out the pregnant mom enough to maybe even cause what they call psychological dystocia.
Okay. Problems having a baby because of
their
all the
labor
stuff
could
that's
slow
going on.
down. And,
well, what about enemas? Many times, when I was in nursing school, they'd give all the ladies an enema right when they came in. Should they do that?
Some still believe that they should have enemas. I know that my doctor backup does not. And
why doesn't he or she do that?
well, God has put into us a natural ability to clean out before delivery. And so that's one of the signs that you're getting close. You're cleaning out.
Mm.
And so here you have all these loose stools, and you're getting ready for labor, and you go into the hospital, and then they give you an enema when there's hardly anything left.
Okay, so it's just more, it's adding insult to injury, or not really, not a birth is not an injury, but it's just adding more stress, you're saying.
Yes, and weakens them a little more.
Okay.
You know, they're,
Anything else that troubles you that you see that maybe is routine in some hospital procedures?
well, yes, in some hospitals it's routine to do forceps deliveries.
And you have a picture of that.
Yes.
And so this picture here, I assume that those tongs there in the hand that's the forceps.
Yes. But most of the time this is practiced because they need to be able to pull the baby out, because the lady has had an epidural, which they would be numb.
So
from
they
the
don't.
waist
They
down.
have that analgesia, is that what you call it? The
yeah.
pain medication or different things, and they don't even feel what's going on, and that's why they normally use these.
Yes, it's hard to push the baby out. They can't even feel it, so they need to use these to pull out. And if they wouldn't get a pain relief epidural, they wouldn't probably have to use this unless the doctor just routinely does this anyway. But it could, if mismanaged, could cause brachial nerve damage or palsy, partial paralysis.
The forceps, because they get over the. What do you mean by that? How does that happen?
If it's mismanaged.
All right. Scarring to the head or anything like that, or other things? Any other
It
problems?
could cause bruising,
Okay.
and
So you're not really a big fan of either the forceps or epidurals, it sounds like.
no, well, of course we don't use
Okay.
any of that at home.
Right.
But but a lot of doctors are leaning toward the more natural birth, seeing that they have less, a very low C-section rate if they do less interventions.
Okay. Anything else?
Another thing that they use would be the vacuum extractor,
Okay. And this is
and
a
that's
picture of that.
less invasive
That's less invasive
in a sense of less injuries.
than, say, forceps.
Right.
And what is this? They just put a little suction cup on the baby's head?
The top of the baby's head, and they pull.
And what could be the problems with that?
Okay.
Will they mess up the brain of the baby or
Well,
something?
just it causes a self-hematoma
Okay.
on top of the head.
Big bruise, huh?
Yes.
So you try and avoid that.
We try to avoid, well, they try to.
They try to avoid that. Okay.
And again, if they are birthing natural, then they could feel when it's time to push the baby out, and pushing the baby out, there shouldn't really be a need for that. Also, when they use that, in order to not damage the mother, they have to do large episiotomies. You know what I'm saying, to reach in there to get a hold of the baby's head, and episiotomies is cutting in the perineum to create a bigger opening, and so they can get a hold of the baby's head. But oftentimes when they're using this pressure, it could cause sphincter damage or tearing through the rectum.
Okay. So anytime you're cutting or any of those different kind of things, you want to avoid that.
Yes.
I think most ladies would want to avoid that too.
Yes. We just use hydrotherapy, olive oil massage,
Hot towels, oil.
olive oil massage, and just controlled breathing to birth the baby out. And in all the 750 births, I've only had to do one episiotomy.
Wow. So 749 have been without that. Natural, completely natural. What about C-sections?
Of course, we don't do anything
You don't
like
do any of those, but
in the hospital. I've only had to transport for C-section 2 times.
2 times. Okay.
Which and I can tell you right now that the doctor that backs me up, he's very encouraging to me about. He has a very low C-section rate because he tries not to be so intervention.
Okay.
But
So that's a major surgery, really. So that's
Yes,
why you
major.
want to avoid that. You already, if you have a baby and you have them, you've already had the baby. You don't want to deal with two things, maybe.
Right.
How can you, how can you choose a competent midwife? What should you look for?
Well, I always feel like they need to make sure that she has a low transport rate. Ask her how many years of experience she's had, if she's lost
Low
any
transport
baby.
rate, you mean by that? Not taking them, a lot of people to the hospital, able to handle
Every
things?
time you turn around, there's got to be, if they're constantly transporting, then maybe they're not screening them out enough.
Okay. Then maybe they're in situations that they shouldn't be in. Okay.
Right. And does she carry medical emergency equipment? Does she have an assistant? Are they on call all the time where they can be reached? And I think probably the most important thing is to have cooperative doctor backup.
So have a
Supporting
physician they're
them.
working with, have the people that, they're not out there on their own, they're not some, just doing things on their own. They have a team approach.
Yes, because if there's doctors backing them up, they must be competent.
We have a couple minutes left. What is the most impressive thing to you about home births, as you've been involved in now 750 of them?
I think the most impressive thing is to see the bonding that takes place in the family, the mother and the father, the children.
I think we have a picture, I don't know if I mentioned this to you, but the producer here of this program just recently had a baby, and I think that we have a picture of of their little baby with bonding that I want to show you here.
Yes. I think it's a beautiful picture of bonding.
I understand that this is only about 5 minutes after the delivery.
Yes.
And is that pretty typical, mom looking at the baby? Do they forget all about that labor and different things at this time, do you find, usually?
Yes, it's amazing how quick they forget right after delivery.
And they just look. Now, you have 2 children. Do you remember seeing them the first time?
Yes, I do.
Did you name them before or after they were born?
After they were born.
Okay. I think your daughter's name is Genesis.
Yes.
And your son's name is Revelation.
No. Jason.
Jason.
Yeah.
Well, it's been a delight to talk with you about this. Really, it's a natural thing that happens in the lives of many women, but so often we don't plan for these things like maybe we could or should.
Right.
And just a very natural, uplifting thing. We've been talking with Patty Barnes. She's a certified midwife. She's delivered over 750 babies. She's written a new book, The Ministry of Midwifery, and she's helped many people just have a wonderful experience bringing a new life into the world in their home or working with a hospital. And we hope that what you've learned has been helpful. God bless you.